Looking for a way to network with your peers, gain valuable clinical knowledge, and earn 50 CE credits from the comfort of your own home? Look no further than NCNP Virtual. The National Conference for Nurse Practitioners live event is coming up on April 7th through the 10th, but with our virtual platform, you will have access to the sessions and credit for 90 days after the live conference ends. Don't delay and visit us online at ncnpconference.com for registration information. In this episode of the Nurse Practitioner Podcast, Kristene Diggins discusses the role of the nurse practitioner for the effective delivery of healthcare during a pandemic. What specific impacts has the COVID-19 pandemic had on the role of nurse practitioners who are on the front lines?
When I think about the role of the nurse practitioner, specifically reflecting in a primary care, urgent care type of setting, it has required us to switch gears from thinking about the chronic diseases and the follow-up of chronic care and really getting us focused on the here and now. This is a pandemic that's in front of us. As nurse practitioners, we can change gears quickly. And I think it's required us as nurse practitioners, I know for me specifically in practice in an urgent care clinic setting, that we really have to be able to think through this is for now, and treating, testing, triaging these patients, it has become front and center to our care. And, you know, that's a change for us because as nurse practitioners, we are usually looking towards the holistic care of the patient. And this pandemic has required that we think differently. So our role is still to meet community needs, but how we're doing that has changed because of the pandemic for this time and place.
What are some of the best ways nurses and nurse practitioners can protect their own physical and mental health to maintain stamina during this pandemic?
So when I think of maintaining stamina during the pandemic, it becomes really important for us to recognize that we must be self-aware, just as we tell our patients to be self-aware, to own their health, to be informed. We must do likewise. And this pandemic has taught us that there's only so much that we can continue to give before we're going to fail our own selves. So being self-aware, recognizing when you need sleep, if you've gotten the sleep you need, recognizing whether or not you're nurturing the part of your health, your physical health, are you getting the exercise that you need? And so I would say this pandemic has taught us to do what we tell our patients to do every day, and that is to take care of our own health needs and be aware, reflect, journal, really the evidence behind being informed in our own care, and that's going to reflect and give us the ability to have longevity in how we care for our patients.
How do nurse practitioners on the front lines impact patient outcomes as part of an interprofessional practice team?
As an interprofessional practice team, it has never been more clear to us during this pandemic that we must be we're not cowboys. We're not out there. Yes, we care about the scope of our practice, but we're not out there trying to practice autonomously solely on our own. We are part of a bigger picture. We're part of the pharmacy team, the physical therapy team, the respiratory therapists. And I think that what this pandemic has taught us is that we are the connection to the patient as nurse providers, nurse practitioners specifically. We have the opportunity to interview our patients, to understand what their needs are, and then to integrate that into their care, and ultimately to know when to refer and bring in specialists and professionals who can help our patients. And, you think of a COVID patient right now on the front line, when we're caring for them, they require often many professionals to see them to their healthiest outcomes. And we as nurse practitioners are charged with doing what we do best for our patients, and that is understanding who they are as individuals and their unique needs to develop their care plan and involve those professionals. So this is an exciting time for us because we can really show who we are in creating those professional teams.
How can nurses who are not working on the front lines best support those who are during this time?
So nurses who are not on the front lines can best support those who are, and nurse practitioners, nursing in general, by remembering, by recognizing the high demand that a pandemic places on us as professionals, by understanding that it may be difficult for us to be able to access evidence, for us to be able to access resources readily. So we depend on our colleagues who may be in a faculty setting or maybe in a setting that it's not in the demands of the front lines, but can support us and can support their nurse practitioner colleagues with information, with understanding, and, with long-term vision, recognizing that during this pandemic, we are focusing on a very acute problem, but that we will get back to primary care as we know it, that we will get back to managing those comorbidities for our patients. And we depend on our nursing colleagues everywhere to be able to support us and keep the big picture in mind so that we can make it through this, just as we do in war times when we think of nursing and nurse practitioners who stand on the front lines but recognize this demand depends on all of us as colleagues to be able to support one another. So I think the main answer to that question would be to realize that every one of us has a different role to play, but to appreciate that and to build our team strong so that we can give our patients the best outcomes possible.
What are some of the best practices to keep healthcare systems aware of the needs of nurse practitioners during such high demands for patient care?
So some of the best practices that I can think of for nurse practitioners to keep healthcare systems and their employers aware of the demands that this pandemic has placed on them is to be assertive. And just as you are in self-awareness of your own care, as mentioned earlier, we must be assertive to our healthcare systems and, protect your time, protect your well-being, because we're in this for the long haul. As much as the COVID pandemic has brought a sense of urgency of acute care needs, and it's brought a sense of demands in front of our patients, we really have to assert to the healthcare system, this is what I can do, this is what I can't do. And that can only stem from self-awareness. And, as nurses, first and foremost, we're nurses. We are able to remind ourselves of who we are as bedside nurses. And that isn't something that the healthcare system can just determine on their own. They depend on us. Our employers depend on us to be assertive and together to make sure that this role stands strong and continues to provide excellent patient outcomes, no matter what the demands are. So again, ultimately being assertive with our own needs and then collectively as a profession.
What are some of the ways the nurse practitioner's well-being influences patient care in daily practice?
When we think of well-being of the nurse practitioner, that's a magnet standard. That is a standard of outcomes that is just timeless. So when we take care of our own health, when we are self-aware and when we are practicing to our full scope, we are providing better outcomes for our patients. So in taking care of our well-being, what the evidence has shown us repeatedly is that nurses and more broadly, nurse practitioners, we can know that when we take care of our well-being, when we assert ourselves and we are self-aware, what does that mean for patients? It means less time in the hospital when you're diabetic. It means better outcomes for hypertensive patients. It means better outcomes with comorbidities because well-being has been shown to be a direct relation to healthcare outcomes. And I think we forget that often as nurses. We're service driven in what we do for our patients. And I think we must remind ourselves that ultimately the best outcomes are the ones we're after for our patients. And looking at these critical indicators, it translates into taking care of yourself. Because when you do, no one else can do that for you. And I think this pandemic has reminded us of that as we take care of ourselves, we are able to continue to perform at the top of our ability as nurse practitioners and make a difference and get to the other side of this pandemic and get back to taking care of the primary care needs of our patient population.
This podcast does not constitute medical advice and should not be taken as such, and does not replace professional judgment or advice. The ideas and viewpoints expressed in this podcast do not reflect the official position of the speakers, authors, affiliated organizations, the Nurse Practitioner Journal, or Wolters Kluwer.